Greetings, loved ones. Despite ongoing debate about the role of formal child protection processes for dealing with psychological abuse, there is agreement about the need to intervene early to minimize poor outcomes. Today, we are in our last episode of 4 discussing child abuse, psychological child abuse. Help us get these messages out. Please subscribe to our channel, follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others. You could save a life. Again, this information is specifically targeted for pediatricians, but it can also apply to anyone who has contact with a child who might be abused. Today, we're going to focus on treatment and guidance through the process. Again, I will emphasize that despite ongoing debate about the role of formal child protection processes for dealing with psychological abuse, there is agreement about the need to intervene early to minimize poor outcomes. It is important to consider what is known about approaches to prevent recurrence of psychological abuse and treat associated impairment once it has been identified. There is a scarcity of studies evaluating the effectiveness of approaches specifically designed for parents or caregivers who psychologically abuse their children. One randomized trial compared 2 group-based cognitive behavioral therapy parenting programs aimed at psychologically abusive parents. The standard program focused on child management strategies, and the enhanced model included components to alter parental anger and misattributions. Parents who are psychologically abusive may not be able to recognize their own behavior and self-refer. Results of another trial suggest that a preschool child-parent psychotherapy program may be beneficial in improving specific aspects of the mother-child relationship, but further research is necessary. Several innovative methods of working with parents with mental health and substance misuse problems have recently been developed and evaluated. There is major need for research to develop and test effective treatments for children who have experienced psychological abuse, either alone or in combination with other forms of abuse. So let's have some guidance here for the pediatrician, but remember, everybody can apply these things. Psychological abuse is just as harmful as other types of abuse. Although little is known about approaches to its prevention or treatment, it is important for pediatricians to be alert to its occurrence and to consider ways to support families who have risk indicators for this problem. Pediatricians should develop approaches for asking children about their relationships with caregivers, experiences of discipline, and feelings of self-worth, safety, and being loved. Bright Futures and the Addressing Mental Health Concerns in Primary Care Toolkit are resources that can assist the pediatrician in evaluation. However, they are not specific to psychological abuse. The pediatrician should encourage parents who are experiencing mental health problems, intimate partner violence, or substance misuse to consider effects of such conditions on their parenting and assist them in accessing appropriate resources, such as referrals to mental health programs and professionals and substance misuse treatment programs. With respect to identification of psychological abuse, it is suggested that pediatricians need to be as confident in assessing inadequate emotional care as physical and sexual abuse. This might include an assessment of parent-child interactions during interviews or consultations with other clinicians, such as mental health providers, to assess the child's feelings and understanding about the situation. As with other types of child abuse, children showing signs of behavioral and psychological problems should be assessed to identify specific conditions, such as depression or post-traumatic stress disorder, for which there are evidence-based treatments, such as cognitive behavioral therapy. Several trauma-specific interviews have been developed to determine whether children and adolescents presenting with mental health problems have been exposed to abuse. To date, such instruments have been used, mainly in research settings, but studies are increasingly examining their clinical applicability. Although the evidence is limited regarding interventions for psychological abuse, it is important for pediatricians to refer families for additional assessment and treatment if psychological abuse or neglect is suspected, in addition to referring to Child Protective Services in accordance with individual state laws, and follow-up appointments should be made so that the progress of the situation can be monitored. Another Equally important aspect of responding to psychological abuse is professional communication. Collaboration among pediatric, psychiatric, and child protective services professionals is essential in formulating a management plan for a child at risk or for experiencing psychological abuse. Specific goals need to be put in place. And in cases where exposure to psychological abuse persists, the pediatrician should advocate for the needs of the child to remain paramount. Although effort should focus on ways to assist the family with the child remaining in the home, it is important for the pediatrician or others to be alert to situations in which a child's needs are better met outside the home, either on a temporary or permanent basis. Considerations of out-of-home care intervention should not be restricted to cases of physical or sexual abuse. Children exposed to psychological abuse may also require a level of protection that necessitates removal from the parental home. Pediatricians are uniquely positioned to educate those working in child welfare, child health care, and the judicial system about the complex needs of children exposed to psychological abuse. Because determination of and response to psychological abuse by child protective services can vary considerably across regions, pediatricians can assist the child protective service workers in understanding the effects of exposure to abuse on the child, as well as possible resources for intervention. The pediatrician is well situated to advocate on behalf of the child and can take on an important liaison role with professionals in the child welfare system. According to the CDC, over half of all children in the world, that's 1 billion children ages 2 to 7, experience violence every year. The question is not if you'll encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, He has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. You are called. We are all called to be champions for justice. If you are a victim of violence, listen to me. I want you to know that you are valued, you are loved, you are intelligent, you are worthy. I want you to know that there is a way out. You don't have to stay in the abuse, and it's not your fault. Abuse is not love. And most of all, I want you to know you are not alone. If you are suffering violence, reach out to someone today. If you find yourself in a dangerous situation, call 911 for help. If you know of a child or other person suffering violence, tell the authorities. In our next episode, we're going to talk about physical abuse of children. Until then, God bless you.